Welcome back.
Okay.
Joining me now for the interview is Dr. Anna Stratis. Dr. Stratis, thank you so much for coming back on the show. I really appreciate it.
Absolutely. It's great to see you.
So I brought you back on because of the state of the coronavirus crisis. I mean, for weeks and some months now, it's sort of died down. We have been following the numbers as well, but now we're seeing a surge of the Delta variant, largely among the unvaccinated. So does this necessarily mean that there's a way out of the pandemic in the future? And what does this mean in terms of the future of the pandemic?
Yeah. Well, back in January to April, I think we were really on a high. I think all of us were like, great, the vaccine is here. Let's just roll out and be done with this, right? We were like, yeah, no problems, get to 75%, 80% coverage of our population so we can get herd immunity. I think sort of in the spring, we were worried because, the big, the G8 countries and so forth were all hogging up the vaccines, and we were worried about developing economies. How are they going to get their vaccine? And that was the big discrepancy. And then the United States came to a grinding halt and stopped somewhere around, I think you'd probably know the statistics. Are we sitting at like somewhere like 45.9% coverage vaccine, like of the fully, where is that in the range of the percentage of the population that's fully vaccinated?
I believe for adults, it's around 63.9, around there.
Oh, okay.
Yeah.
Okay, got it. So our major, and then we realized, and then it's also playing out in other countries too. Then we realized the major problem, and to be honest, ID officials, infectious disease officials were really projecting this, that vaccine hesitancy, misinformation, the nonsense of trolling, social media bots, the dark web, all that is the biggest public health crisis, is this misinformation campaign. So I think what we're looking at now is complete dismay, because we had a chance, at least in the United States, if not globally, to really lock this thing down. We have failed tragically. This is like the demise of our civilization. We couldn't even get this right. For the stupidest reasons. And it is like, how badly have we declined in our education, that science is not trusted, that quacks like Mercola, who's this idiot quack doc who stands worth $100 million because he sells his supplements. How do we get here?
Yeah. We've been seeing reports in terms of vaccine misinformation and also fraud when it comes to coronavirus. There was this report of a Republican official who was just indicted on federal charges for like selling this fake COVID-19 cure. So, I mean, how do you get that trust restored back into the CDC and these other public health institutions?
I'll tell you, the damage here is it'll take generations to get out of this, because things like public health measures, things like vaccines, there's just such a vulnerable, fragile trust in the community. And we've been working for generations, for decades, to really maintain, to create and maintain this trust. And so it's out the window. This isn't just a few years of an effort. And it's going to play out in vaccines for childhood immunization. We're going to see, could we see polio come back? Already children have missed so much, including education this past year. They've been missing out on their routine childhood vaccination. So we're really going in a dark direction.
When it comes to what we're experiencing now with the Delta variant, and sort of the CDC just now recently reinstating their mask guidance. And as local officials are trying to do this, particularly local officials who still believe in science, who are trying to do this, they are getting lots of pushback from Republican officials. So in that case, how do you make this state a safe environment when you have like COVID deniers and anti-science people in leadership?
I mean, that's the point. It isn't just, there's no way. There's no way. I mean, it requires public health officials just trying to be blue in the face and hoarse by just trying to keep banging the drum. But to be really, really clear, and I'm a really big proponent of this, vaccine mandates.
Mhm.
That the only way to get over this nonsense noise of vaccine deniers is to be like, well, you have to get it. And I've spoken with people who really hate the fact that their individual rights are being taken away. But in public health, there are few to no individual rights. It's how public it's our the way public health has been mandated. We agree that the health and the wellness of the population is more important than that of a select few. It's the
Mhm.
collective. It is what it is. So there are federal, I believe Biden just announced that all federal employees, save the military, have to be vaccinated, except
Mhm.
or they have to jump through a bunch of hoops. New York Health and Hospitals has come out to say you got to be vaccinated, and there's no other way out. And Google, Facebook, Netflix, they're all like, vaccination. To get back into the office, you need to be vaccinated. And I gotta say, and I think that's where public health officials are realizing it's not the incentives. I was on a train, on the A train just yesterday, and there were these kids loudly proclaiming, they were like, oh, we haven't got the vaccine. But they were saying they're giving away $100 to get a vaccine. These kids were like, that's cool, but that's not what is going to get us vaccinated. It is, you can't operate in society if you're not vaccinated. And you know what?
Mhm.
I say, hell yeah.
Mhm.
Because this is ridiculous. It's ludicrous. We got to shut this virus down, and got to get vaccinated. Yeah.
When you look at the certain things that countries are doing, particularly, I guess just particularly in the United States, because not any other country is really doing these huge incentives. Um,
Mm.
does that, I guess, sort of make it a national embarrassment that we have to do these incentives
Yeah.
for people to get vaccinated?
Lotteries.
I know.
Yeah. And it's ridiculous because, when I was vaccinating in the Bronx, like in January and then in April, people were banging down the doors to get their vaccine, right? You
Mhm.
didn't have to pay them. And now this sort of everything has been turned on its head. So, if I were, as I was, a person who got vaccinated early, now I'm thinking, man, if I had just waited out for 2 months, I could have gotten $100 on that. So, it is the problem is it's sending out so many messages from either
Yeah.
side of the mouth, right? Saying, get your vaccine. And it's like, well, we'll give you some money. So, it just, and so, what if people are waiting to be like, hey, it's $100 now. What if it's like $300 next month? I'll wait.
Yeah.
It's an
That is,
embarrassment.
yes. That's also the danger that we're dealing with here. As people are saying, I mean, the longer you hold out to get vaccinated, I guess your luck is about to run out when it comes to contracting COVID. One local doctor
Oh
just
yeah.
just recently said that. When you think about all the misinformation online, there was this recent article from the New York Times talking about how this private group is getting paid millions spreading this misinformation on
Yes.
Facebook. Um,
Yes.
how do we combat this misinformation? I mean, one thing that has been said, what Republicans are arguing is that, hey, if you cut down on our, I guess if you cut down on this, it sort of infringes on the First Amendment rights. I mean, you do have free speech, but then again, free sp-
Right.
you don't want to. There's a limit in to like leading to like the death of someone with all this misinformation.
Right.
President Biden
Yeah.
has really just excoriated these tech companies with this. So how do we combat that?
You know what? You can't take these guys to court. Here's the
Mhm.
thing, over the next 30 years, we have to put in place real education reform, because if you're not able to synthesize information, it's because your school wasn't great. Your schooling wasn't great. Your mom is behind the eight ball because she's working 3 jobs. She doesn't get to tutor you at home. You're not getting great food. You're not getting great exercise. So you're restless and you have hyperactivity and attention deficit. You know, this is the only way to correct this is 30 years of consistent education reform, because when you have a good education, you will not fall prey to this stuff.
Mhm.
Full stop. And I'm afraid nothing short of that is going to get at this misinformation. This is a downstream effect to the erosion of the quality of education in this country.
Now that we're seeing the Delta variant among more of these variants that we already have, um, if the pandemic continues to go on, are we going to get more variants?
Oh, yeah.
Okay.
Yeah. The longer this virus is allowed to play in our population, it's going to continue to mutate.
Hmm. Okay.
That's the
Wow.
problem. This is a time game. The virus is having a great old time right now because there's not enough pressure. There's just too many places, too many bodies for this virus to go.
Mm,
And the problem is too, is that when there is such a high rate in the population, it's pressuring the bodies of the vaccinated people because it's almost like, the vaccine is like a dam. It's trying to keep the flood out, but it can't keep the flood out 100%. There's going to be leaks in the wall, right?
mhm.
And so the more pressure, the bigger the flood is, the more leaks in the wall there is. So, our vaccines, the vaccinated are only as good as the participation of everyone. And if there's a sizable amount of non-vaccinated, the vaccinated people are still at risk.
When it comes to people who are fully vaccinated, I think there are still studies being conducted on this, but how long would that immunity last? And would we need, I guess, more shots in the future?
Mm. I think we were really excited and very joyous, triumphant, and confident a few months ago. And I think we're
Mhm.
losing because I don't think anybody saw the stupidity, like the scale of the stupidity in this country. And that the variants would take a hold at such like ICUs are full, crammed full. So I'm afraid that the optimism is probably waning because even Pfizer, small sample size, but they're saying that the coverage for the Delta variant isn't as great. And I think that the other vaccines will follow suit. We're going to see that the virus is going to start chasing us out. And that's what's going to make it's not that the vaccine won't have a long duration of effect. It'll become like the flu vaccine. It's that because the virus keeps mutating, so it's always developing a little shield that can evade that vaccine. That's why we have to reboost with another booster the following year, and that's what's going to happen with this damn coronavirus.
Hmm.
So
There
we're
was
yeah.
there was this one report published in Alabama's local newspaper about a doctor and her patients. I guess as they were getting ready to be intubated, they then at that point they finally wanted the vaccine after saying that
Yeah.
they were. I guess they basically denied that COVID existed. They thought the
Yeah.
vaccine was political or something
Yeah.
that the government was trying to do. And
Yes.
this doctor had to tell them, I believe as a nurse, she said it was too late because I mean, they had multiple chances, but this was their final, I guess, their
Yes.
final time. So,
Yeah.
how do we avoid
Yeah.
that? I mean, then there's this one patient at this other hospital who said he would he would rather get COVID than get the vaccine. So, how do we avoid that? I guess this
And
deep distrust and erosion of science in our country.
I mean, you're absolutely right. I mean, and what's ridiculous is that anybody says, I'd rather get COVID than the vaccine has obviously never had severe COVID illness because,
Mhm.
we don't have any cases of an exception to this rule. All of the flooded out ICUs right now are populated by unvaccinated people.
Mhm.
And every single one of them, barring the very few exception, always says, I regret not getting the vaccine. So this is ridiculous. Like it's absolutely ridiculous because it's not like the anti-vaxxers are holding on even when they have severe COVID illness and they're going to die.
Mhm.
They're expressing regret. So if you're going to stand by your choice, the problem is that we have become so detached from each other in our society that when we see people dying on TV in our neighborhood and our family, we're like, that doesn't really exist. It's not going to happen to me.
Mhm.
And that's our critical problem is that we're not taking seriously. There's nothing that will help us get into the empathetic shoes to understand what's going on for other people.
Yes, yes, exactly. I was, as I was doing some research, there was this Time Magazine article where they'd said, like, I guess a list of things that would make people more likely to get vaccinated, like if their family members had COVID, or like if a celebrity gets publicly
Yeah.
vaccinated. In terms of, I guess, motivating people amid this new vaccination campaign, um, how do you do that? I mean, we're seeing these incentives and everything, but then there's also this misinformation. One of my
Mhm.
friends was recently on TikTok and he called me and talked about this
Ah,
misinformed video on TikTok. And I had to convince him that that was misinformation and he's now planning on getting vaccinated. So how do you, I mean,
gosh.
because this misinformation, I mean, this is like, is there like a certain way to like hold tech companies accountable for this as all this is just running rampant? I mean, how do you deal
No.
with this?
The problem is, and actually to your point with your friend, the problem is now all we have to do right now is do vaccine mandates. So you can't go to work, you can't engage in certain parts of society without your vaccine. And then it's one-to-one convincing people.
Hmm.
And and that's the problem. It's like you telling your friend and correcting the information. It's me telling a person I know, and she got her vaccine a week ago.
Hmm.
She was on the fence, and but the problem is you can't run a public campaign. It's such a grindingly slow rate,
Yeah.
but that is the only thing that's going to nudge numbers. And that's what infectious disease specialists are saying. It's like one misinformation debunking at a time. It's having conversations, open-minded conversations with people, not shutting them down,
Hmm.
hearing what their reservations are saying, just offering up another viewpoint. And
Yes.
it's insanely slow. And I have very little hope. Yeah. But it's worth it. If you do have a family member or a friend, it's worth it, and don't shut them down with, yelling, screaming, because that will stop a conversation. But you might just, or share an anecdote. Honestly, with this girl last week, it was me saying, did you know that I was in the hospital in Brooklyn in April 2020 and I saw
Mm.
hundreds of people dying all around me, speaking to me 1 minute, dead within hours, people having their chests pumped on, dead bodies in the waiting rooms. So, weirdly, my story, my viewpoint, I've had people say, oh, you know what, and barring none, here's the thing, people who don't take this seriously, we're not living in New York or a highly concentrated epidemic area.
Mhm.
Because if they hear the stories, they're like, whoa, okay, maybe I should rethink this.
Mhm.
If you haven't seen it with your own eyes. So if you have any sort of story, share it with people.
Yes, most definitely. Um, Google and Facebook are now issuing a vaccine mandate for office workers there. Exactly what you were saying. Um, do you think these mandates are going to work, or do you think that they'll be, I guess, criticized or framed as somehow political or the government wanting to do something?
Yeah, there's inherently a problem with vaccine mandates. We shouldn't have to go here.
Mhm.
The problem is that it is corporations and governments getting into individual rights and people's business. When your teacher's like, okay, guys, I'm going to give you 10 seconds to settle down, because if you don't, then I'll have to cancel our trip, right?
Mhm.
This is the equivalent of the teacher coming in being like, okay, guys, I didn't want to have to do this, but this is
Yeah.
what's going on. I'm afraid we have no other choice.
Hmm.
It it's if we had all acted maturely at the start and just rolled up our sleeves and done the deed for public health and for the public good, then we wouldn't be in this situation. And I don't see any other way.
Do you think I guess perhaps because I was looking back on some historical context, if we were less polarized as a country, if we had less propaganda and misinformation, I guess that there'd be more trust.
Yeah, of course. I mean, the sharp division among Republican and Democrat lines is
Mhm.
shocking.
Yeah.
Like the number of vaccinated versus unvaccinated in the Republican camp versus the Democrat, and then the independents kind of fall in between. It is so insane.
I
It's
know.
insane. How on earth did we get here where we're deciding on public health measures according to our voting
Mhm.
tendencies? And you can only imagine, like, if there were another government trying to control the United States population, my God, they're having a field day right now, because this population is so stupid, right? Right, because the
Uh-huh.
more people, the more Americans die, the more that they're left out, the more kids that are left out of school and have to, carry out lockdowns. If there were another country that were interested in seeing the demise of the United States, well, they'd be winning right now.
I
So,
know. Yeah.
do I suspect that there's foreign interference? Yes. Are they doing a great job at that interference? Hell yeah, they are. And they're picking on ignorance.
Yes, these misinformation campaigns that we're seeing a lot of.
Mhm.
As the more elite countries, such as the United States and other countries, are doing these vaccination campaigns and trying to control the coronavirus, we do have to look out for some of the other countries as well, such as South
Oh,
Africa and Malaysia and India and some of the other
yeah.
countries. I don't think, I think what people don't get is that if the coronavirus is good here, we're all good, but
Oh,
we still have to help out the other countries because it can still spread back to our
yeah.
shores and this pandemic will be
Yeah.
indefinite. So how do we work to help out
Yeah.
those other countries as South Africa is now going through their third wave?
Oh my gosh. And did you say that one person in South Africa is
I
is
think
vaccinated?
the vaccination rate right now is like 1%.
Oh my God. I should I mean, so the thing is that the United States and other wealthy countries, including Canada, are guilty of hoarding and hogging the vaccines at the start. So
Mhm.
that this rollout was never designed to be fair. It was like wealthy countries get theirs first, and then everyone else can kind of be dealt the extras or the leftovers. And to that extent, I guess it can, the United States started opening up once the United States vaccination rates started grinding to a halt. So obviously, fair access to vaccines, and I should say too, in India they are charging for the vaccine.
Hmm.
It's in because of that idiotic political situation in India. So and so the problem is there's not a lot of governance, international governance, to make sure that countries are not charging for this damn vaccine, which is just
Yeah.
ludicrous, right?
Yeah.
I think the big thing though is the United States, like it or not, is a thought leader, a global thought leader, and the problem is seeing this whatever storm going on in the United States with the vaccine, a total failure, not a total, but a pretty phenomenal failure of vaccination. And they're a thought leader. Other countries are watching the United States. And if the United States is having all this, misinformation, well, that spreads to other countries because, like it or not, the United States influences the way people think around the world.
Hmm. Yes, most definitely.
Mhm.
When it comes to
I know it's heavy, right? It's like there's no good news this week.
I know. I've talked
Oh
to
man.
people who expressed some frustration about what's currently happening of fully vaccinated people having to put their mask back on
Mm,
indoors specifically.
yeah.
I think when it comes to people who are unvaccinated, are there certain things that can convince them, if not necessarily, I guess, these incentives, but actually seeing like images or, I guess, videos of people in the hospital? But then again, with that, you do have to, I guess, think about the fact that some of them think that those people are acting.
Ah,
Yeah.
yes.
So, and
Yeah.
I've seen doctors and medical workers now expressing frustration as this is happening now. They're also
Yeah.
seeing more younger patients than the
Oh,
first wave. So,
absolutely.
yeah. Could you talk a little bit about that?
Well, I mean, there's a real problem. In fact, I have a client who works in an ICU in a hard hit Western state, and the burnout in the ICUs is atrocious. And
Hmm.
there's several reasons why that's so dangerous. Is number one, they've come through a year and a half of burnout, right?
Hmm.
There seemed to be some good news in the fall because after that huge peak in January, the numbers were plummeting because vaccines were starting to take hold. I think there was a lot of hope. And now we're back where we started for the stupidity, for the like, and so you've got a bunch of folks working in the ICU. Nobody cares to listen to doctors or nurses.
Hmm.
Nobody's interested. Falling on deaf ears. Nobody gives them kudos for their job. Some people think they're faking it.
Hmm.
And they continue to be working overtime. The ICU shifts are being chock-a-block. There's attrition that we're losing healthcare workers to suicide, and there's no news coverage because nobody cares. Like, no, the news cycle, it's fatigued about burnout among healthcare workers. Nobody cares anymore.
Yeah.
So the problem is, I think we're losing a cohort of our healthcare system.
Do you think,
And yeah,
sorry, go ahead.
no, that's just a big sigh. Yeah.
Yeah. Do you think that, because I've been looking at the news coverage as well, Do you think that Americans and people all over the world have sort of become, I guess, desensitized
Mm,
to the coronavirus now? I mean, at first we
yeah,
were sort of expressing grief and frustration over 200 deaths a day or 1,000 deaths a day. Now it's just normalized.
yeah,
And also the adulation of public health workers has stopped.
yeah,
Um,
yeah.
do you think people are starting to act like the pandemic is a thing in the past now?
5,000%. Yeah. And so much so the news is just very half-hearted about their coverage too. Because
Mhm.
the Olympics are on, which was ridiculous, absolutely ridiculous to hold the Olympics.
Yeah.
Which, by the way, and look, the spillover effects of stupid decisions are seen in the mental health crisis of Olympians,
Hmm.
specifically Olympians of color who already are behind the eight ball. There's all the isolation of having to run and to compete without audiences, of these draconian measures in Tokyo to try to, all at the expense of the Olympians. What the hell were we thinking? So the
Exactly.
problem is everyone just thinks this is post-COVID business as usual,
Hmm.
but it so is not, and it is having a toll on the most vulnerable people in our society.
Yeah, it definitely is enraging. And when you talk about the mental health crisis, you go back into sort of what's happened over the past year and currently now,
Mm,
with, I guess, some children now ready to go back to school,
mm,
or getting or still staying home.
yeah,
Um, when you look at the data, there are some kids who can't necessarily learn at home, who don't have the resources or who have been struggling with mental health because of the
yeah,
pandemic.
yeah,
It's not being talked a lot about in the news publicly, so lots of people don't
yeah,
necessarily know that this is going on.
yeah,
Um, I mean, how do we deal with this now? I've recently shared my story on my YouTube channel about
yeah,
grappling with mental health. Um,
yeah.
I mean, how are we working on this now?
Yeah. And Jeremiah, thank you for taking the bold step, because without your voice, these things remain in the silence.
Thank you.
Um, I think the problem is, so, my husband works for a UN agency that oversees the health of children, and
Mhm.
mental health is becoming a major new mandate of this government agent, or sort of this international agency. Um, and so it's being talked about, but the problem is it's all ivory tower discussions. It's not discussion amongst the people. So
Mm.
again, there's no news coverage. Here's what I'm seeing. There's a major class system starting to emerge. So in September, there are parents for whom they have the resources. The parents are well equipped to be able to homeschool. Their internet connection is present and strong. They've got all the socioeconomic sort of supports that make homeschooling a great thing for them. And they will continue to, in states that don't mandate everybody going back, they're going to continue to do homeschooling. And then there's going to be a lot of students where their parents, or or they have health conditions where they say, I don't want to send my kid back, but
Mhm.
then they don't have the supports for homeschooling, and they will lose another year, two
Yeah.
years. And then there could be people going back to school. I'm not too worried about the schools being a huge hub of infection, but it scares enough people, and those who are scared to go back, a lot of them are not going to have the resources for homeschooling. And you
Mhm.
will not see news coverage about this, but you'll see all the well-equipped, well-resourced, wealthy people going along just fine in their homeschooling way, and then a whole bunch of kids will be left behind, and it's going to come right down class lines.
Yeah, there was this I guess this article at the headline talked about the lost generation and the last lost year of
Yeah,
learning because of the pandemic. As we are getting back into what some people are describing as quote unquote normal, um,
mm,
we're going back into the society where people, I guess a lot of people are grappling with different things like mental health, still dealing with
right.
COVID, after seeing the devastation. I mean, how do we get back out there now?
Oh, yeah. I mean, I honestly, how do we get back out there? I think we take a, personal choice. I have clients who are very, very hesitant still, and they're not going out in public. And I think we have to sort of listen to our comfort zone when it comes to, if you find yourself that you're still very scared. Look, honestly, if you're still very scared to go out there, I can't reassure you, because even if you're
Hmm.
vaccinated now, I'm kind of like, well, we're still screwed, actually.
Yeah.
Yeah, because because of the big mass of people who are not vaccinated.
Hmm.
So I think we have to put in place policies that protect everyone. The mask mandate sounds like a very reasonable thing to bring back with all these ridiculous numbers.
Hmm.
Um, and then we have to sort of allow people to make their own decisions. Those who are very hesitant, then let it be. But how do we reach out to those people to keep including them? Because the problem is now, last year everyone was locked down, and now there's going to be certain people for whom they have pre-existing conditions, or they're very scared justifiably, and they're going to miss out. And
Hmm.
and the mental health is going to decline even more. And they're
Yeah.
going to be the silent people that we won't see.
Hmm.
And if I may actually ask you, what are your thoughts in terms of going back to school? What are your thoughts about like the mental health ramifications that you're seeing in your school?
Hmm. Yeah, so I think because of a year of isolation and not necessarily being able to, I guess, have conversations and interact with your friends in person, I think, I guess, for some of the first time, I guess you're sort of excited to go back to get some of that, I guess, interaction there.
Mm,
But then again, you do still have this skepticism about going back in the state of the
mm,
pandemic.
yeah,
And then you also think about it, well, you stay home, your mental health's going to continue to decline even more. So
yeah,
that's also what you're thinking about there
yeah.
as you get ready to make this return, not necessarily back to normalcy now.
No. Wow. No,
Mhm.
absolutely. And I guess it has to be a balance of very judicious decisions at a public health level, state level, city level, and also just respecting people's personal choices and comfort when it comes to going back.
Yeah.
Yeah.
One of the things that you've talked about here on the show is the Canadian healthcare system versus the United States healthcare system, and
Yeah.
how for the US it's kind of like profit over lives.
Yeah.
Um, even
Yeah.
even with the pandemic, that's still happening. So
Yes.
how do you work to like fix the healthcare system with that? Because now people are recovering from COVID, but then they still have to go pay these hospital bills.
Oh, and the long haulers, right? Folks with
Yeah.
long haul symptoms. Oh, yeah. And, yeah, insurance and hospitals are going to collect their pound of flesh because,
Hmm.
there's going to be people who are doing all the long haul stuff, and, there'll be a very conspicuous absence of talk about covering their bills for sure. I
Hmm.
think it's terrifying. I think that we haven't even started to calculate the medical debt that's going to be faced because of COVID.
Yeah.
I haven't heard anything. And when I don't hear about something, I'm like, okay, that's horrifying because it's underreported, it's not covered, it's not calculated, it's not being looked at. It's terrifying. It's
Hmm.
absolutely terrifying. Um, you know, and Canada, the funny thing is, like, you see another country, and it's not just one thing that's different; it's everything that's different, right? So, Canadians are quite dutifully rolling up their sleeves, even though we did not have the vaccine supply because the United States did not fulfill the orders that we had put in. But so what we did is we prioritized first doses. We were just like, okay, everyone get their first dose, and we're trying to catch up with the second. And and I'll tell you, there's still people on my timelines on Facebook, my Canadian friends and acquaintances, who are posting their pictures of their second dose. They're
Hmm.
still waiting in line for their second doses up in Canada, but they're doing it. They're
Wow.
Because there's so much more uptake. There's a whole bunch of vaccine deniers up in Canada, no question, but it
Hmm.
is to such a different degree, and it's not political. Well, okay, it is politicized. The province of Alberta is a complete shipwreck
Uh,
because they're the most conservative government, right wing government. It's a trend.
mhm.
But Alberta aside, everyone's kind of doing their part. And then, for any COVID illness, you've got a single payer healthcare system that is, covering this. You're not going to have people losing their shirts because of medical debt.
Mhm. Do you think that there should be some sort of, I guess, federal exception? I'm not necessarily sure
Mm,
if you could implement that when it comes to hospitals because you got like private
yeah,
hospitals and things.
yeah,
But now people are going to have to deal with this. There was
yeah.
this one mother. She was sort of skeptical about getting the vaccine because of I guess it just came out, it was early, and so now that she has just tested positive for COVID-19, she spent, I think, a couple of weeks in the hospital. She's now encouraging others to get
Oh my
vaccinated.
God.
Do you think those stories, she's also going to get her family vaccinated now too. Do you think those stories, specifically with people seeing that, would sort of cause people who are skeptical or reluctant to sort of say, maybe I should rethink this?
No, because there's a frightening individualism over the collective that has really been propagated by this capitalist society. And
Hmm.
so the problem is that these are horrifying stories. And you know what? Even people in their own family will be like, nope, not getting the vaccine.
Yeah.
And until we kick that, and it's the same thing for single payer healthcare. If the average American is like, oh, I'm not going to pay for somebody else's laziness, if this if the individual American doesn't see that bad luck could hit anybody, that you're not special, you're not sort of anointed as the person for whom bad things won't happen. Like everybody has to pay into the insurance
Hmm.
because bad luck could befall anyone. There's nobody better or worse than anybody else.
Hmm.
So until that ditching of that individualism happens, and that sense, that humility to realize you're one of many, bad luck could happen to you too, and you kind of just all got to pitch pennies into the pot. And so when you need it one day, you can draw from the pot, and until then, yeah, you pay some taxes.
Yeah.
And same thing, you see people who get horribly ill and run up debts of like $500,000, right? And to your question, is there any way in this complicated, nonsensical healthcare systems to sort of institute a federal sort of mandate on covering COVID-related illness? Hell no, no way in
Hmm.
hell. The only way to address this is to introduce a single payer healthcare system. And until the United States gets their act in gear, whether it's coronavirus, whether it's then a novel influenza, whether it's a huge terrorist attack, they're going to continue to suffer because they do not take care of their people.
Yes, most definitely. This is there was some recent reporting out of Missouri about people sort of getting their vaccines in private,
Oh my God.
because I
Yeah.
guess fear of judgment from family members.
Yeah.
There's such a divide now where people aren't even talking to family members or friends anymore about getting the
Yeah.
vaccine.
Yeah.
What do you make of that we're going this far in terms of encouraging people to get their vaccines in private if we have to?
Yeah. Isn't it insane?
Yeah.
Like, there's no words. There's absolutely no, you're right. There's radio silence between the two camps now. We get our news from different sources.
Hmm.
We are living on different planets.
Yeah, when I initially saw that reporting, at first I thought it was a joke, but it apparently was
It,
real.
it is, and you know what? And I get it. Yeah, it's quite astonishing.
Hmm. Once again, my guest is Dr. Anna Stratis. Thank you so very much for coming on the show. I really appreciate it.
It's my pleasure. You take care, Jeremiah.
All right, thank you. You too.
Okay.